Hey everyone, it's Dr. Steinway again, and I wanted to talk to you a little bit about one of those kind of age-old questions like, should I get an implant for my missing tooth or should I get a bridge? So bridges have been around since Egyptian times. Basically, we're using teeth on either side of an area where you're missing one or more teeth to basically make a cemented restoration. Think of it as like two crowns with a tooth floating in the middle. Basically, in order to do this, we're going to need to prep the neighboring teeth down to a smaller size to be able to put the crowns over top. It's cemented in there permanently, never gets removed, it's not removed at night or anything. Functions, looks exactly like more teeth are present, but basically we're relying on the neighboring teeth to support it. A situation like this, we have to make sure that both of the teeth or all the teeth that are being involved with the bridge are really healthy and stable enough condition to do that. We don't want to have a failure of the restoration because of a bad tooth. There's a couple more factors with this. We can have decay on the bridge, we can have loosening of the bridge, things like that. But again, this has been around for a long time and it's an acceptable treatment for many people in many cases. One really good thing that's been developed though is the dental implant. That allows us to keep both of the neighboring teeth intact as opposed to having them to prep them down to a smaller size for crowns. Basically, we're leaving the teeth on either side completely intact, we're not involving them in any way, and we're doing a single standalone tooth to replace it. Works really well, especially if we're only replacing one tooth. With these two different types of restorations, there's obviously pros and cons to both. So we'll start with the bridge. Pro, relatively short procedure. All I need is an overnight to make a bridge for you. It's a lot faster of a procedure. There's not as much involved with the surgical side of it. We're going to talk a little bit about cons. If either tooth involved don't really particularly need to be crowned for any other reason, we are going to have to prep away some of the tooth structure, some of the natural cells. We have to remove those in order to make space for the bridge. So that would be viewed as a bit of a con because there can be some irritation to the teeth on either side. And especially if they don't need crowns, the idea of prepping them for crowns is a little bit less favorable. Implant next. A major pro of this is we get to leave either tooth on either side completely intact. We don't have to prep them down for crowns. And in addition, the longevity on an implant can be as much as 30 years, where the average lifespan of a bridge is about 10 to 15 years. When we're doing an implant in an area where the tooth's already been extracted for a long time, it's about a 4-month wait for the crown to be done and do you have your tooth back. So that can be viewed with some people as kind of a con, that it's that much time to wait, 4 months. I will say that the time goes a lot faster than you'd think. Either way, we have two good options if you're missing one or more teeth in the back. So if you have any questions about this, you're welcome to call our office and we can schedule a consultation appointment to talk about your particular case.